is Christina. I'm an LPN student at Bates Technical College, and we're going to be doing sterile wound care today. I looked up the MAR, I checked the protocol, and I looked up and I collected all of my supplies. Hi, Miss Mary. My name is Christina. I'm going to be your LPN today, and we're going to be doing some wound care. How are you feeling?
Oh, you know, those drugs are really working.
Well, I am glad they are, because I gave them to you a half an hour ago to make sure that you were ready for me.
Well, I am definitely ready for anything right now.
Great. Let me get my gloves on real quick.
Yeah, do you think we could be fast about this?
I will try.
Jeopardy's on in 20 minutes.
I will try my hardest so that you are not late for Jeopardy.
And I really like Jeopardy, Christina.
I like Jeopardy too. All right.
Hey, check name.
What?
Verify name.
That's what I was going to do.
Oh, sorry.
All right. Can you tell me your full name and date of birth, please?
Mary Smith, January 26, 1922.
And I see that you're allergic to penicillin, iodine, ink, and sulfa.
Yes, ma'am.
Okay, let's go ahead and check out this wound. Tell me if you're too cold.
No, I'm actually pretty hot. So
Okay.
Can you just take down the whole blanket? That would be great.
We can do that. I will still keep you nice and covered to protect your modesty.
Thank you.
Okay. So I got my supplies.
Red
Okay,
bag.
I need to get my red bag out of here. And my hands are not dirty because I did not touch anything. So we'll go ahead and open my dressing, staying on the 1-inch border. And reaching in and grabbing this red bag, red biohazard bag. Miss Mary, I'm going to put this right next to you. Is that all right?
Yeah, that's okay. Just don't get the yucky stuff on me.
I will try my hardest.
So do you have to change a lot of wounds today?
You are my first. I just got here.
Oh, so you have a long day ahead of you.
All right, I will make sure to pull the skin taut so that I am not hurting the patient when removing the tape. Then I will look at the wound, check for color. It's a little pink. I do not see any exudate or sloughing. It looks good. All right, I'm going to go ahead and remove my gloves. Sanitize my hands. Put on another pair. All right, Kay, I'm going to be measuring this wound. Will you write down the measurements for me, please?
Sure will.
Thank you. All right. All right. The wound seems to be 11 centimeters long. Three centimeters wide and 1 centimeter deep. All right, this may feel weird, Miss Mary. I'm gonna have to roll this around inside and look for tunneling.
Thank you, Laura. Bye, Laura. See you tomorrow.
I am not finding any tunneling. The wound looks to be healing well.
Great, because I'd really like for it to be gone. It's so annoying. No offense to have you guys in here every week. Every week I have to have this changed, and I really don't like it.
Soon, Miss Mary. Very soon.
That's what you guys keep telling me.
All right, I am going to set up my sterile field. Give me just a moment. I'm going to reach in and grab my drape. Only touching the outside. And only touching the outside of the box, I'm going to dump my supplies. And then I will put the sterile water in my container, open it up, pour a little bit out, turn it, and pour the rest in my container. And this is now garbage. Okay, looks like it is time to put on my sterile gloves. Sanitize my hands. Okay, well, only touching the outside, and a 1-inch border. Okay, pinch with the dominant hand on first.
Step back.
Oh, I will step back. And I will cup. Non-dominant hand. Separate my supplies and put my gauze in my sterile water. And then I will clean the wound. All right, Miss Mary, this is going to be a little cold. First, I will go through the middle. And I will go on the side. I'll go on the other side. I will come back over here and get my sterile gauze. I'll wring out the gauze and then pack the wound. That one is no longer good. We will get another piece. And it does not want to come off my tweezers. Okay.
Because it's not wet.
Because it's not wet. Okay. And then I will.
Don't touch anything with that. That's a non-sterile glove because you wrung out the.
I will use my sterile hand and pick up the other gauze and place it over the wound. Now I no longer need sterility, so I can take my gloves off. And sanitize my hands and put new gloves on. My tape is already ready for me, and I have already put my name, date, and time on them so that the next nurse knows when to change the dressing. touching the outside of the bag as not to dirty my hands. Touching the outside of the bag. Okay, that is done. We'll put this in the biohazard container.
Gloves.
I will take off my gloves. Sanitize my hands again. Miss Mary, how are you feeling?
I feel great. Thank you. And just in time for Jeopardy.
Awesome. I'm glad we could do that for you. I'm going to give you your call light and you let me know if there's anything else that you need, and enjoy your show. Would you like to continue laying down?
Yes.
Okay.
I'm fine. Thank you.
I will lower the bed.
You have to turn it on first.
There we go. After turning it on. All right, the bed is lowered, locked, and safe. I will sanitize my hands again, document all of my findings, and that is it.